Dissociative amnesia is a complex psychological condition characterized by gaps in memory that cannot be explained by ordinary forgetfulness. These memory gaps typically center around traumatic or stressful events and go beyond typical absent-mindedness. Individuals experiencing this condition often cannot recall important personal information or specific traumatic events, yet their overall cognitive functions remain intact. Unlike other forms of memory loss resulting from physical injury or substance use, dissociative amnesia is fundamentally a psychological defense mechanism, the mind's attempt to protect itself from overwhelming emotional distress. The condition manifests in several distinct forms, including localized amnesia, inability to recall events from a specific time period, selective amnesia, remembering some but not all events from a traumatic period, generalized amnesia, forgetting one's entire life history including identity, and dissociative fugue, temporarily assuming a new identity while traveling away from home. Each type represents different degrees of memory disruption, with symptoms potentially lasting from hours to years depending on the individual case and the severity of the underlying trauma. Trauma lies at the heart of dissociative amnesia. When someone experiences events beyond their emotional capacity to process, such as childhood abuse, military combat, natural disasters, or personal assault, the mind may compartmentalize these memories as a protective measure. This psychological defense mechanism temporarily shields the individual from confronting overwhelmingly painful experiences, but comes at the cost of memory continuity. The condition disproportionately affects those who have experienced repeated childhood trauma or those with genetic predispositions to dissociative responses. Diagnosis requires careful professional evaluation to distinguish dissociative amnesia from other medical causes of memory loss. Mental health professionals typically conduct comprehensive interviews, psychological assessments, and sometimes neurological examinations to rule out physical causes. Many patients present with secondary symptoms including depression, anxiety, sleep disturbances, and relationship difficulties that compound their condition. The very nature of memory loss often means patients seek help for these secondary issues rather than the amnesia itself, as they may not be aware of their memory gaps. Treatment typically follows a trauma-informed approach centered on creating safety before addressing forgotten memories. Psychotherapy remains the cornerstone of treatment, with approaches including cognitive behavioral therapy, psychodynamic therapy, and specialized trauma therapies like eye movement desensitization and reprocessing, EMDR. These therapeutic methods help patients process traumatic experiences at a manageable pace while developing healthier coping mechanisms. In some cases, hypnotherapy may help access buried memories, though this remains controversial among experts. Memory recovery, while possible, follows an unpredictable timeline and isn't guaranteed. When memories do return, they often emerge gradually rather than all at once, requiring ongoing therapeutic support to process. Clinicians approach memory recovery cautiously, acknowledging that the goal of treatment isn't necessarily to recover all lost memories, but rather to help individuals function effectively despite their memory gaps. The therapeutic process focuses on developing a coherent personal narrative that acknowledges trauma without being defined by it. Support systems play a crucial role in recovery. Family members and close friends can provide emotional stability while respecting the patient's need for psychological safety. Educational resources help loved ones understand the condition is not deliberate and requires patience. Support groups connect patients with others experiencing similar challenges, reducing isolation and normalizing their experiences. These combined resources create a comprehensive care network that supports long-term healing. Research continues to enhance our understanding of dissociative amnesia. Brain imaging studies have identified distinctive patterns of neural activity during dissociative states, potentially bridging psychological theories with neurobiological mechanisms. Advances in trauma-informed care are improving treatment approaches, while public awareness campaigns are helping reduce stigma around trauma-related mental health conditions. These scientific and social developments offer hope for more effective interventions and greater acceptance for those affected by dissociative amnesia. The portrayal of amnesia in popular media often misrepresents the reality of dissociative amnesia. Films and television frequently depict dramatic, complete memory loss followed by sudden, complete recovery, scenarios rarely seen in clinical practice. These portrayals can create unrealistic expectations for patients and their families while trivializing the genuine struggle of those living with the condition. Mental health advocates emphasize the importance of accurate media representations to foster better public understanding and reduce stigma surrounding this and other mental health conditions. The journey through dissociative amnesia is deeply personal, with recovery looking different for each individual. While some regain most lost memories, others may never fully recover certain experiences, yet can still achieve psychological well-being. Success in treatment often means learning to live meaningfully despite memory gaps rather than focusing solely on memory recovery. Many who receive appropriate treatment develop remarkable resilience, finding that working through their trauma, even with incomplete memories, leads to profound personal growth and a renewed sense of identity that incorporates but isn't defined by their past experiences.